What happens to your pancreas after distal pancreatectomy? Imagine losing part of a vital organ and wondering how it will affect your health. When a surgeon performs a distal pancreatectomy, they remove the tail and part of the body of the pancreas, often including the spleen. This procedure is common in treating pancreatic cancer located in the tail or body of the pancreas. But what does that mean for your body's function? Let's explore what happens after this surgery. First, removing the tail and part of the pancreas significantly reduces the amount of pancreatic tissue left in your body. Since the tail contains many insulin-producing cells, this reduction can lead to a decrease in insulin secretion. As a result, some patients may experience issues with blood sugar control and, in certain cases, develop diabetes. The risk varies depending on how much pancreas remains and whether there were pre-existing metabolic conditions. It's important to note that insulin resistance, which is when the body does not respond well to insulin, usually doesn't change much after surgery. The main concern is the decreased ability to produce enough insulin to keep blood sugar levels stable. The pancreas also produces digestive enzymes that help break down food. After a distal pancreatectomy, many patients retain enough of their pancreas to continue digesting food normally. However, some may develop pancreatic exocrine insufficiency, which means their pancreas isn't producing enough enzymes. This can lead to difficulties absorbing nutrients, causing symptoms like diarrhea or weight loss. In such cases, doctors might recommend pancreatic enzyme replacement therapy to support digestion. Structurally, the remaining pancreatic tissue often undergoes changes. Imaging studies may show that the leftover pancreas shrinks or becomes atrophic, and the pancreatic duct may appear dilated. Sometimes, the head of the pancreas enlarges slightly to compensate, but this varies from person to person. These changes are important to monitor because they can influence how well the pancreas functions and can sometimes mimic signs of tumor recurrence on scans. One common complication after this surgery is a pancreatic fistula, which happens when pancreatic fluid leaks from the cut edge of the remaining pancreas. This occurs in about 1 in 4 cases and can cause fluid collections or infections. Fortunately, most fistulas can be managed with drainage and supportive care without further surgery. Overall, after a distal pancreatectomy, the remaining pancreas adapts to its new state. While there is a reduction in insulin production, many patients maintain good blood sugar control with proper management. Digestive function often remains adequate, but some may need enzyme supplements. Regular follow-up with healthcare providers is essential to monitor blood sugar levels, nutritional status, and any potential complications. Every patient's experience is unique, so personalized medical advice is crucial. If you're facing this surgery or have concerns, always consult your medical team to understand how these changes might affect you specifically.